2,400 unionized Kaiser mental health care workers are on strike after both sides failed to reach a labor agreement.
The workers, united, will never be divided.
The workers are striking in Southern California and San Diego. They say that the walkout will not end until a deal is reached. Robert Garrova is a mental health reporter for LAist. Thank you so much for being here. This is a strike that's impacting one of the nation's largest healthcare providers. When you look at it, I've talked to so many mental health care professionals who really this started for them during COVID, where they started having their own mental health issues and realizing just how much work they were putting in to their jobs and the self-sacrifice. These negotiations in particular started back in July. The union saying Kaiser's created a substandard system of care. Can you kind of dive in here and take us through why these employees, from what you've heard specifically, are walking off the job?
Yeah, I mean, I guess similar to what you heard. I mean, I've been talking with therapists, other mental health professionals leading up to the strike. Went to the picket line out in front of the Los Angeles Medical Center on Sunset yesterday. And I keep hearing over and over that, therapists are seeing between 10 and 18 patients a day. They're burnt out. They're stressed out. They're struggling to do their own self-care. And one of the biggest things that they're pushing for that they say is going to lead to better patient care is getting 7 hours a week to handle things on the back end that is not included in their back-to-back-to-back appointments. Things like filling out patient charts, following up with phone calls, emails, required government follow-ups that they have to do. So that's one of the biggest things. They're also, of course, fighting for better wages and better pensions. Kaiser has pointed out that, that right now they're offering 18% wage increase over 4 years.
Well, when you look at the Kaiser system, Kaiser mental health care workers in Northern California went on strike for 10 weeks back in 2022. They did get higher wages, and they did get some of the other benefits that you're talking about. I think it's interesting that this does come at a time where employment in the mental health field, the Bureau of Labor Statistics says, is going to grow 3 times faster than the average U.S. job position. So these are workers that are really needed here. What are you hearing on the other side of this debate?
Well, I mean, one of the things I've heard from therapists and from a researcher who works with the National Union of Healthcare Workers is that, Kaiser has made some progress in hiring therapists over the last few years, more than 1,500 therapists hired. But the turnover is still a concern, for the researcher and others at the union. 1 in 4 of those 1,500 hired have already left since they've come on. So, I've talked with folks at Kaiser who say, they're just seeing people drop right and left, and, even patients who have said that they've had 3 therapists in 1 year because the first 2 quit. So I know that's going to continue to be an issue, not just for Kaiser and, but every other mental health provider.
Well, you think about that, too. If people are going through 2 or 3 different therapists, I mean, that's just a stop-start for the patient. So that's one impact. Are you hearing about other impacts to patients with the strike itself?
Well, we know from the Northern California strike that there were over 100,000 appointments canceled. A lot of those were rescheduled, but the union didn't feel like those were rescheduled to a proper level. It's unclear, how that's going to work now. I know that state senators have been pushing Kaiser to see their contingency plan. They are required to continue to provide care, even during a work stoppage. So, Kaiser says that they're on it, and we have, legislators. Mike McGuire sent a letter yesterday saying that he's going to, he wants to see that contingency plan and wants to know specifics of what Kaiser's doing to make sure people don't get left out.
Yeah, I mean, the Kaiser Family Foundation showing 9 out of 10 U.S. adults believe the country is in a mental health crisis. So these are caretakers who are definitely needed. Thank you so much for being with us this morning. We appreciate it.
Thanks.
We did reach out to Kaiser Permanente for comment. They say in part, today's strike is entirely unnecessary and unfortunately not surprising. NUHW leaders have been threatening to strike since before we began bargaining in July. The union has been slow walking negotiations despite the strong proposals Kaiser Permanente has put on the table. The union's proposals at the table have been overreaching and unreasonable.